Great. Hi. Good morning. I'm Dr. Dash. I'm from Mount E Novena Hospital. And today I'm going to just give you a quick talk about the three most common gynecological issues that most women should know about. Before we start, I actually want to reiterate about what Dr. Tao said. It's very important that all women above the age of 25 all the way till 45 should get vaccinated with the Gardasil 9 vaccine, because I think that's the most effective vaccine so far in the market, and I advocate it for everyone as well. So let's go on with my talk. So poll question, which of the following symptoms do you face right now? So here are the ones. So things like heavy or painful periods, lower back pain, frequently going to pass urine, pain during intercourse, or something else. If you do have one of those, sit still and listen to my rest of my talk and see whether something might be popping up in your mind when I talk to you. So what are ovarian cysts? Oh, so in Chinese, they call it 水瘤. So ovarian cysts are basically fluid-filled sacs in the ovaries. That means there are little bubbles in your ovaries, and they can contain a lot of different kind of things. Sometimes it could be just water. Sometimes it could be just pus. Sometimes it could be blood. And sometimes it could be lots of other things like bone and other wonderful materials as well. Now, not many women actually come to the gynecologist when you have ovarian cysts because it's very common and can go away without treatment. But unfortunately, sometimes it can cause serious problems. And that's when a visit to your friendly gynecologist will be very useful. Now, why is it very serious? Because sometimes these ovarian cysts can grow really big and then they can rupture, or they can twist and cause a lot of pain. In other more serious cases, ovarian cysts can also cause infertility, and the women may find very much difficulty in trying to conceive in the future as well. So for this, what we always advocate is see your gynecologist every year. When you do your pap smears, as what Dr. Zhao mentioned, it's also a good idea for us to do an ultrasound of your pelvis to have a look at your uterus and your ovaries to make sure that you don't have any ovarian cysts at all. Now, in the US, they found that 5 to 10% of women actually go on to have surgeries to remove ovarian cysts. And the only way they found out is through regular screening. Not many times do you actually come up with symptoms of the pain and bleeding that we've mentioned before. Sometimes it's just found out during health screenings as well. Now, out of the 100% of cysts that we remove, only about a fifth or less actually found to have cancerous or other serious consequences. Most of them are benign and are safe for the patients as well. However, the only way to ensure that you don't have any ovarian cysts is to get the ultrasound early. Now, these are the symptoms that you could have when you have an ovarian cyst. A very dull ache in your lower thighs or in the lower pelvis, or a severe pain during your menstruation that comes on and off, and then once your period ends, it goes away. That could be a symptom of endometriosis or some other ovarian cyst. Sometimes you might have a sudden ache and a nausea and vomiting in the middle of your cycle. That means 2 weeks after your period ends, you have a sudden pain in your lower abdomen. That could actually indicate an ovarian cyst as well. And sometimes breast tenderness as well. Now, we all know that when we have premenstrual syndrome, which is called PMS, we do have all these symptoms anyway. But what differentiates PMS from severe pelvic pain and ovarian cyst causing pain is that it constantly increases in severity, and it doesn't go away. That's when you know that you need to have a check. Now, how do we remove these cysts? It's very simple. As mentioned before, 70% of these cysts can actually go away by themselves. Sometimes I will give the patients contraceptive pills or some other medications to kind of deal with the pain, and within 3 to 6 months, it will disappear by itself. Occasionally, it continues. To make sure that these are not cancerous, I do some cancer markers and some other hormonal blood tests as well to make sure that this is not something serious. And thereafter, we need to discuss what sort of surgery is necessary. And remember, not all cysts need surgery. So when we do surgery, we can do what we call a pinhole surgery or laparoscopy, or if it's really big and you waited too late, and if it's more than 5 to 10 centimeters, we need to do an open surgery, which we call a laparotomy as well. So over here, you can see a picture of a surgeon performing a laparoscopic surgery. In these kind of surgeries, you have very minimal scarring. It's only 1 or 2 or 3 holes done in the abdomen. We fill it up with gas. We have a look and see where your ovarian cysts are, and then we do a removal for it. In most cases, up to 80%, it doesn't reoccur anymore, so you're quite safe. However, in about 20% of cases, in the next 3 to 6 years, some patients do come back with a reoccurrence, and then a repeat surgery might be necessitated. So the final one we're going to talk about, the second one we're going to talk about is endometriosis. Now, a lot of young women talk about painful periods. That's when, you get the severe cramp, you need Panadol menstrual, and it makes you feel better. That is not an indication of something severe. It is an indication of something severe if you find that even painkillers are not helping you anymore, or you find that during intercourse you have a lot of pain, or you find that when you take painkillers you start getting diarrhea or some other lower back pain or dull aches in your thighs. That's when it's indicative that it may not be just a simple menstrual pain, but something more sinister like endometriosis. So when your womb lining decides to be naughty, and instead of shedding out through the vagina during your period, it decides to spread. It goes into the womb, it goes into the muscle of your womb, or it goes into the tubes and it settles in your pelvis or in your ovaries. That's when endometriosis occurs. It's when the womb lining decides to travel around the rest of your body instead of being shed. And when it starts depositing here, the problem is these are live womb lining cells, and they start growing and they live there. And every time you have your period, you also have bleeding in those areas where the pockets of endometriosis lie. And that's when you have the severe discomfort. Many of these deposits, when they go onto the ovaries, they become cysts and they start getting larger and larger. They could also block your fallopian tubes and cause fertility issues as well. This is why endometriosis is actually increasing in terms of diagnosis, and we try to help the patient earlier on. One thing to remember, though, is that even though endometriosis occur in about 1 in 10 women, a lot of them go undiagnosed. Unfortunately, there is no way to reduce the occurrences nor to reduce the severity. It's only when we finally diagnose you with endometriosis are we able to actually help you with the treatment. So the only way that we have for a lot of patients is to start contraceptive pills early if you're above 21 years old, and to reduce the amount of menstrual pain that you have. And that's the only way we have in terms of preventing from having unnecessary surgery in the future. Now, these are the symptoms that I've mentioned before. The number one, of course, most common cause is very severe painful periods. Low abdominal cramps, sometimes it goes to the back, sometimes it goes down your thighs, and it could be really severe in nature. See your GP first and see whether that helps. If that doesn't help, see your gynecologist. And what we do is we have a range of pain relieving medications that can help you to basically cope with the pain. If this doesn't work, that's when we start you on hormonal manipulations. You don't always necessarily have to have contraceptive pills, which can cause a lot of side effects. There are medications which are only progesterone based only, such as Visan, which we can take for 3 to 6 months, up to 2 to 3 years even, which can help you with your endometriosis. The other kind of symptoms that you might have is excessive bleeding. If your period used to last 3 to 5 days, but then now in your mid-30s, it's lasting up to a week or more, that could be an indication of endometriosis. Because as mentioned before, endometriosis can suddenly go into the womb lining and into the muscle, and it can cause this condition called adenomyosis, where your womb is excessively big and it's very tender during your period, and it causes very heavy periods during that time. The third one is quite severe, which is infertility. So like I mentioned before, sometimes the endometriotic deposits go into the tubes and they live there, and then they start causing blockages. Again, the problem is it might not show symptoms because you don't know that you're infertile. It's only years later when you're trying to conceive and you find that, it's a bit difficult. And then your gynecologist does a tube test, which is called a hysterosalpingogram, where we push a little bit of dye through your uterus and into the tubes, and we see whether there's any blockage. Unfortunately, by that time, it's a bit too late, and we may need to talk about other ways of getting you pregnant through IVF and other sorts. Let me just go on to endometriosis prevention. So this is something very important to remember. Unfortunately, there's no clear-cut way to prevent the the fact that the endometriotic cells decides to go deposit on different parts of your body. So we can't really prevent it, but we have found that if you take the contraceptive pill, it reduces the amount of menstrual bleeding that you have, and it can actually reduce your symptoms and perhaps reduce your chances of developing more serious endometriosis. The other way is, of course, to reduce the amount of estrogen in your body. So ensure that you have a good BMI, eat healthy, reduce the amount of estrogen by exercising more frequently, and of course, drink less alcohol and caffeine as well. If you have a family history of endometriosis, if your mother or your sister has severe pain or difficulty conceiving, it's a good idea before you even try to conceive to see the gynae to ensure that you don't even have it in the first place. This way, if you find out that you do have any fertility issues, the gynecologist can actually start helping you earlier rather than later. Now, in terms of treatment for endometriosis, they've got quite a good range of it. Of course, the first thing we do is just pain relief to make you nice and comfortable. So we've got the Panadol, we've got Synflex and other things which can reduce your menstrual flow as well as reduce the horrible cramping that you have, so that you can lead a normal and healthy life without any discomfort. If all that doesn't work, we then go on to hormonal therapy, which is basically the first line will be things like the contraceptive pill. Some patients are averse to it because they feel that they can increase weight, or they might have mood swings and other side effects from the combined contraceptive pill. Therein comes this medication called Visan. Visan is a progesterone-only pill, and that can be taken for a very long time, and that can actually reduce your chances of developing more serious endometriosis. And we've also found that it can actually reduce the amount of effect that it's caused on your ovaries as well. So that's one thing that we can do to manipulate your ovaries and your uterus. Finally, and that's the last line, is basically surgery. So unfortunately, when you do an ultrasound, we can't tell how severe endometriosis is. Sometimes in the most severe cases, I've seen a very normal looking uterus and a very normal looking ovary. But when we do the laparoscopic surgery, when we enter into the pelvic cavity, we find that there's deposits everywhere. And then we help the patient by doing some ablative surgery, which is where we burn off all these endometriotic tissues, and then we try to clear up everything. And occasionally, when there's a very blocked tube, we'll try our best to unblock the tube so that the patient still has an opportunity to get pregnant naturally without needing any IVF. And finally, we have hysterectomy. These are more for patients who've already had their families and they've completed everything, and they still have very severe painful periods, and they don't want to take contraceptive pills or hormones because of the risk of breast cancer and other issues. For these patients who are usually above the age of 40, we would then go and discuss about hysterectomy and removing the ovaries very early. But that is always the last line of defense. Now, the third thing that I'm going to talk about is uterine fibroids. Now, endometriosis, as I mentioned before, is when the womb lining decides to be naughty and spreads into the muscle layer and the ovaries and different parts of the pelvic cavity. Fibroids, on the other hand, are basically non-cancerous tumors of the uterine muscle. Now, even though we say non-cancerous, there is a very, very low chance, about 0.05% of chance, where the fibroid can actually become cancerous. This is called leiomyosarcoma. So occasionally and very rarely, when we do a fibroid removal surgery of patients, we have discovered actual cancer inside as well. And sometimes the ultrasounds that we do may not be adequate. And the only way to find out that this fibroid is cancerous is after removal from the surgery. Now, a lot of these fibroids are found in late age after 35. Occasionally, when you're pregnant, we are able to find it out a bit earlier as well. Now, we only treat fibroids if A, it's above 5 centimeters, or if it's causing a lot of problems such as fertility issues, very heavy menstruations, or is occasionally causing constipation or bladder issues because it's so big and causing a lot of pressure. Now remember, almost 99% of fibroids are non-cancerous, and they don't need to be removed unless excessively big or symptomatic. Now, 40 to 50%, that's almost half of women would have fibroids, and we're not going to do surgeries for all of them. And so it's only during ultrasounds that we find out that someone has a fibroid. If you're trying to conceive, that's also very important, where you might want to do an ultrasound beforehand to make sure that you don't have any large fibroids. Because one of the things during pregnancy is that if you have a fibroid that's only just 3 to 4 centimeters during pregnancy, because of the hormones, it can actually increase in size. And that can cause a lot of difficulty during pregnancy because it can prevent your baby from turning down. It can cause you to have a C-section, or the fibroid can cause a lot of pain during the pregnancy itself. So if you're trying to conceive, you might want to do an ultrasound to make sure that you don't have any fibroids in your uterus beforehand. Now, what are the symptoms of fibroids? So most of the time they're actually asymptomatic, but when they're bigger, you can have a lot of bloatedness or discomfort in your tummy. So if you feel very gassy for no reason, that might be a fibroid causing it. Sometimes it can cause a lot of pressure on your bladder, and then you find that you're passing urine very often. Sometimes if it's located at the back, it can cause a lot of constipation for the patient as well. Now, one of the most common complaints that I have from patients is very heavy periods. So the patients come in saying that the periods used to last 5 days, but now it's lasting 7 to 10 days, and it's very heavy. You've got blood clots. And then when we do the ultrasound, we find fibroids. When we find that, then we do a simple removal, or we can talk to the patients about different other options as well. Painful periods are usually rarely attributed to fibroids. Most of the time, painful ones are attributed to endometriosis, which we talked about earlier. Now, the conventional treatment, from your slide, you can see over here will be things like myomectomy, which is where we literally go in through the laparoscope and remove just the fibroid. If the fibroid is excessive, or the patient has actually completed family and she's had her babies already, then we would usually advocate a hysterectomy as well. Now, besides these two conventional treatments, there are other ways of reducing the size of the fibroids, which I think Dr. Manish will be talking about later as well. Basically, you can reduce the blood flow to the fibroid to help it shrink. There is a surgery called HIFU, where it's a non-touch technique where we can actually blast the fibroid so it can shrink without needing any surgery at all. And there is also a medication in the market right now which can reduce at least 30% of the size of the fibroid as well. So we do discuss these options first before we come to the conclusion that the surgery is necessary for patients with fibroids. Now, in terms of the medications, if the patient has very heavy periods, we try to manipulate the patient with some hormones or some medication to reduce the flow of the period. It's only if the medication doesn't work that we go towards something more surgical or vascular related. Now, one thing to remember is if you don't do what we call hysterectomy, which is a complete removal of the uterus, fibroids can regrow, because fibroids are little seedlings that are found in the muscle layer. And even if you've had a surgery before, there'll be tiny seedlings that can take about in the next 5 to 10 years to grow, and then you may need a second surgery thereafter. There are also cases of familial fibroids where the mother's had 10, 20 fibroids removed before, the sisters have had it, and then the patient herself finds herself having fibroids every 5 years and needing surgery. That kind of condition is quite rare, but I've seen it before. Unfortunately, when you've had multiple surgeries for fibroid removal, that can affect your chances of getting a pregnancy or keeping the pregnancy for long. So these are cases where we need to make sure that we make the right decision before surgically removing these fibroids for patients. So thank you for listening.